Hello, dear colleagues. We again online, and today I feel more confident because a lot of members from our first lectures. I have seen Florian, our guest speaker for the first lecture. Are you in train for Florian? It looks okay. I will not ask your questions today. I see Marcin Orzechowski, who will be our lecturer for today. Ineta Lipša is with us, great expert from Latvia. Next to her, Aiste Žalnora, expert from Lithuania. And Maija Tomsalu from Estonia is also here. And Marika Garnizone from Riga also here. It means that we can start. I'm very happy to see the colleagues from the previous lecture. Zhao, Eugenia, greetings to you. Eva joined us today. It's very nice because a Polish national delegate will support for the Marcin Orzechowski, who is originally from the Poland, and his lecture will be about the situation, politicized medicine in Poland. Richard, nice to meet you. Natal, very nice that you are here. Yes, and of course our friend from Israel, John Donchin, is here. Yeah, we are waiting, everybody waiting for your seminar in Riga or online. Pavel Aldis will be our technical assistant today. As usually, he is Nadezhda, Evgeny, Natalia, Arkady, Professor Zavyalov is here, Yekaterina and Natalia. So actually more than around 50 people already registered. Even the president of our society, Professor Carlos Vesca, has registered, but I believe he will join during the session because we have quite big time difference between Latvia and Mexico. I think it's 10 or 11 time zones. What we will do today we actually will continue our, let's say, session or our panel on the politicized medicine, which expected to be with the two lectures. First one you already have seen, and the good news that today, just now, we published the link for the first lecture on our website, and also I published in chat, so you can copy. Those of you who hasn't seen Professor Florian Steger lecture about politicized medicine in the German Democratic Republic, you can do it after our session or so. We will work in the similar format. As I told, this project of the lectures for International Society for History of Medicine is supported for German Baltic Hochschulkontor. So we have pre-recorded these lectures actually in August. Lecture today will be for 13 minutes. And as I told, our speaker today will be Marcin Orzechowski. Topic is the same, politicized medicine, but today we will look more closer to the Polish People Republic, and his topic will be specifically policy approaches towards combating venereal diseases from 1945 till 1989 in the Poland Republic. So that is my short introduction. I expect that after 13 minutes we will be more, and we will have again interesting discussion as a last time. And at the end, I will provide you some instruction what we will do in future. Actually, I would like to hear your suggestions, who will be next for our online lectures in preparation, let's say, Congress in Riga.
Thank you for having me here, and I would like to present the presentation on a little bit more specific topic. So I would like to talk about the politicized medicine in the Polish People's Republic. So this is the time period 1945, 1989, when Poland was under Soviet influence and was the part of the Eastern Bloc. And maybe a very short explanation why we started to looking into Poland. So Professor Steger at the end of his presentation told there's a need, there's a necessity to look for this topic of politicized medicine in comparison to other countries, maybe East-East comparison, West-West comparison, but to look for other examples, how was it done in other countries. And this is the very beginning, starting point to look into Poland. How was the politicized medicine in Poland? How did it function there? And look at the examples also of venerology wards, venerology stations, venerology facilities. Look, are the characteristics the same or similar as in GDR, or there's the difference? And the beginning of such research would, at least in our concept, starts with looking into the legal regulations. How was treatment of venereal diseases regulated in the Polish law in this period? Where the differences from other countries, in what tradition stood this approach? So, starting with the background, so the Second World War, as Professor Steger said in his presentation, in Germany there was a very high need for treatment of venereal diseases, and we can also say it for other countries in Central and Eastern Europe, but especially in Poland. So there were very many reasons for this outbreak of venereal diseases, which was very high in Poland. There was movement of troops, destruction of the infrastructure, medical infrastructure. There were no physicians, there were very little nurses who would treat these diseases. So there was this epidemiological situation shortly after 1945 was very dramatic in Poland. And you see here, so this is the part of the city of Szczecin. I will later talk a little bit about the Szczecin as a particular example, but you see that the city was almost completely destroyed because of the defense of the city and attack from the Soviet troops. So if we look at the numbers, and maybe it's always the question, how reliable are the numbers of spread of venereal diseases in this year, how reliable are the sources? But we maybe see some kind of trends. So here are the numbers for the syphilis and gonorrhea in the Polish People's Republic starting from 1948 until 1989. So we see that shortly after the end of the war, the spread of venereal diseases was very high. So there were very many people infected, and then due to very drastic or very particular political and also medical measures, these numbers fall down. However, if we look at this trend, so there's in gonorrhea, in the middle of the 1950s, there's a second rise, and then also goes from the beginning of the 1960s, also go, so this peak in spread of gonorrhea in Poland, which is only then cut down at the end of the 1980s. So we see that the problem with venereal diseases was during the whole period of the Polish People's Republic, and we will see that attempt to stop these diseases was done by political acts, by legal acts that, that aimed to combat this disease. So the aim of our project, of our research that we have done in the last few months was to analyze the legal regulations for the control and combat and for combating venereal diseases in the Polish People's Republic during this period. And we put 3 particular research questions in this project. So first of all, what policy measures were adopted after 1945 and during the communist period in Poland? Then we wanted to know in which tradition these policy approaches stood. Were they adopted after the Soviet model, or was it a more Western approach? How Poland tried to combat venereal diseases in these 45 years? And also we wanted to see how similar these measures were in Poland and in other countries, particularly in the GDR, because GDR right now in the literature is most prominent example of special measures to control and combat venereal diseases. So very shortly about how we did this, so about the method, we use documentary approach, documentary analysis of legal acts that were issued in this period in Poland, and these legal acts that were issued by the official organs of their country. The time frame, so the whole, so after the Second World War, when the communist regime was started in Poland until the end of the communist regime, and we looked in the database of legal acts. So there's a system, internet system in Poland in which you can access all legal acts that were issued since 1918 in Poland, looking through the keywords. So we have chosen several keywords like venereal diseases, gonorrhea, syphilis, to look which acts answered to these keywords. And also to put this whole research, to put these legal acts in some kind of context, we have research for the secondary literature using the PubMed, Medline, or Web of Science databases. So not only to rely on the legal sources, but also try to contextualize them. So as to the results, here you see the most important legal regulations that aimed at combating venereal diseases. And first of them, so this is this decree that was issued in 1946, so very shortly after the Second World War. And this already gives some kind of hint how important this issue was. So it was one of the first legal acts that was issued in Poland after the Second World War. So the combating venereal diseases stood as a high priority in the political situation in Poland. And this decree was in power throughout the whole communist period. So until, and even longer, so it was until 2002 that this decree was officially taken out of power, so only in 2002. The second very important act that regulated this issue is this regulation of the Minister and Health from 1964. And if you remember this trend of spreading venereal diseases, you will see, so here we had the situation where the morbidity of venereal diseases was very high, and here, middle of the 1960s, this was the second peak for the gonorrhea. So this legal act answers to this new need for combating venereal diseases. And in these acts, we have found several central topics that, well, are very prominent. How to organize anti-venereal approach? What kind of policy should it take? So, first of all, the whole organization of on the country level, then how the diseases should be reported. Was the compulsory hospitalization and actions against several groups. So, starting with the organization, so in Poland, the organization was very centralized. So at the top we have the Ministry of Health and Social Welfare, which had under it an Institute of Venerology, and then in every district of the country we have venerology stations for outpatients, and in every region, so there were 22 regions in Poland at this time, we have a venerology hospital for inpatients. So this very hierarchical structure to reach all the patients in the country. And the second particular policy approach was organization of this so-called movable sanitary columns. So these were teams like this, a doctor, a nurse, and the driver, or a second doctor, or a second nurse. So very small teams that moved into the villages or small towns that didn't have any antivenereal establishment or facilities, and conducted the tests. They gave patients penicillin, but also what is very important, they also had this some kind of propaganda actions. So on the city square or the village square, they gathered the population of the village and they projected a movie or something like this, or they had some kind of referat lecture about how it is important, how important it is to go to the doctor with a venereal diseases, or when do you have a venereal disease. So the second topic that is very important in this act is the reporting obligation. So the patient, an individual who thought that he or she has a venereal disease had the obligation to go to the physician under threat of jail or fine. This threat of jail was later taken out as a punishment because it was thought that it is too hard, but it had an obligation, and the physician had an obligation to provide the information about this to the regional administration with the name of the patient and about some kind of information how this patient contracted the diseases and who it may gave it to. And then this local or regional administration looked for the peoples that had contact with this person, this patient 0, and also send them for a treatment, for an antivenereal treatment. Sometimes it was done with the support of the police forces. The third result or third topic that was very important for us in this research was the compulsory hospitalization of patients, or the treatment of venereal diseases only took place on the outpatient basis. So in Poland, in this decree from 1946, is already written down how a treatment of venereal disease should take place. And you have here four different methods. So the physician chosen by the patient, in a medical facility for general health care, in a venereology health center. So these were outpatient methods, and one inpatient in a hospital ward. And this is very similar what we have in the GDR, where you have seen this was this multi-step procedure of 3 steps. However, in Poland, if you see in GDR, these steps came after one another. So first, the outpatient treatment, and if the patient did not comply with this outpatient treatment, it was the patient was sent to a closed ward, hospital ward. In Poland, it is a little bit different. So the decision which of these methods was taken by a physician who under which care was the patient. So the physician could tell this patient goes to the outpatient clinic or should have compulsory hospitalization in an anti-venereal ward. And there are several reasons for compulsory hospitalization: if there was a danger that the patient will spread the disease, if he or she were not following treatment recommendations, but also very important, if the hospitalization allowed rapid recovery, because it was very important for the production in Poland, for the economy in Poland, that the patients came back very quickly as workers, as farmers, as any other occupations. So occupations that they have. So the doctor could say, if in his opinion hospitalization will allow very quickly recovery, the patient should go to a hospital ward. Then another result, and it is about particular groups of society that were targeted during this time, and the Polish legal regulations mention 2 groups. These are prostitutes and alcoholics. And also these groups are not mentioned the whole period, for the whole communist period. So first, prostitutes were mentioned as a target in this decree from 1946, but then in 1949 there was a very small change in this decree, and the word prostitute vanishes from the decree. So, and then it is said, so the target of anti-venereal actions should be particular groups of society. So the word prostitutes disappears for about 15 years. And in 1964, at the peak of the, at the second peak of the gonorrhea epidemics, this regulation brings back prostitution as a target of a special actions, special anti-venereal actions, and also brings back intoxicated individuals, so alcoholics. So in Poland, anti-venereal actions concentrated since 1964 on these 2 particular groups of the society. So the groups that were deemed unsocialistic, that were deemed that they didn't follow the socialist rules. So these were the main results of this research. So we tried to discuss this, we tried to look at the secondary literature, how, what these results actually tell us. So first of all, they tell us that the Polish regulations after the Second World War strongly followed the Soviet model. So before the Second World War, we have two approaches. We see in the literature discussed were two approaches to combating venereal diseases. So first approach, epidemiologic medical approach, which was introduced in the Soviet Union. It was based on massive treatment of the population, massive investigation who has a venereal disease in a society, massive examination, and the anti-venereal actions were centrally planned. The second approach, which was mostly visible in the Western Europe, but also in the pre-war Poland, it was the police sanitary approach. So the actions here were targeted mostly in particular groups, so we don't see this massive examination and treatment, but rather a focus on a particular groups in a very small areas, like, for example, major cities. So after the Second World War, there's the Polish regulations. We see this influence, very strong influence of the Soviet regulations. Then, if we look at the compulsory hospitalization, and it was very interesting that in the secondary literature we have found the possible cases of violation of this legal regulation that was in force. So, right here I would like to show as an example the dermatological and venerology ward for women in Szczecin, which was established shortly after the Second World War, and it was part of a general hospital in Szczecin. And in Szczecin, in the 1960s, we see a surge, a very high number of people that were infected with gonorrhea, and particularly of women. And that's why very many of these women were compulsorily hospitalized in this ward. So the sources say about 366 women in 4 years, from 69 to 73. And very interesting is who was hospitalized and how this procedure of hospitalization was done. So we see this is the number 336 in these 4 years, and more than a half of these women which were hospitalized there were arrested and committed directly by police. So we see there is no decision of the physician whether there is inpatient or outpatient treatment. Directly, police brought women to the ward, and they were hospitalized there. Among these women, so about 1/4, about 25% are the prostitutes, but very high number, so quite high number, 72 individuals were minor girls. So there were girls up to the age of 18, which were also arrested and committed by police. And this is the similarity that we see with the GDR, where this was this particular social category of drifters. So, for example, girls or women that were away from their parents' home, and they were arrested by the police and brought to the ward. And if we look at the age of these girls, so we see there are girls as young as 14 years old committed to this ward. The number rises as the years move on. So, and of course, the highest group is between 17 and 18 years old, but it's still quite high, the number of the girls that were very young. And 67 of these girls are described as drifters, so so they have this special characteristics that probably made police to put them into the venerology world. So 67% drifters, and they are very often described as sexually promiscuous girls. So they have many sexual contacts. And also interesting is that in some cases the girls were committed by the parents or some kind of educational institution. So if we can very shortly compare Polish People's Republic with the German Democratic Republic. So we see several similarities. There's common availability of anti-venereal treatment, very dense network of such institutions, and also this method of actively tracing the sources of the infection, and of course compulsory hospitalization. What differences are? There's much more lenient attitude towards compulsory hospitalization in Poland, at least in the legal regulations. So in the legal regulations in GDR, there was this multi-step procedure, so the patient should go after the procedure, but it was inevitable. If the patient didn't comply, the patient landed in a closed venerology ward. In Poland, at least in the legal acts, physician's assessment, who should go, who should be hospitalized, and who should not. And also there is no information about closed venerology wards in the legal regulations in Poland. So in the German regulation, there is that the patient is subjected to hospitalization in closed venerology ward. In Poland, there is no such thing in the legislation. And also in Poland, we see that very specific social groups were the target of this regulation, namely prostitutes and alcoholics. These groups are not mentioned in the GDR regulation. However, in the GDR regulations mentioned are sexually promiscuous persons, so these HGV persons, HWG persons. If we very briefly also look into other countries of the Central Europe, we see that very similar regulations were taken in the Czechoslovakia and in Hungary. So it's only just the beginning, so we don't have very conclusive results, but we can also say that the Soviet model of combating venereal diseases was also taken in this country. There was mass examination of the population, and very often targeted, so in both countries targeted were particular groups of the society, namely prostitutes, often not in legal documents, but in official speeches described as parasites. And there are some hints that also in these countries the compulsory treatment of these individuals could take place in closed venerology wards. So to conclude my presentation, so in this period after 1945, the control of venereal diseases was closely related to perceived moral problems of the socialistic society, so namely prostitution, sexual promiscuity, and alcoholism in Poland. However, we can say that the Polish regulations in this in this area were a little bit more lenient than similar acts in other countries, especially in the GDR. We see some hints, some probabilities that compulsory hospitalization occurred with a breach of legal regulations. However, what is still unknown for the Polish People's Republic is the instances of work therapies or re-education, as we see this in the case of GDR and the closed venerology wards there. So this would be a research desiderate. After looking into the legal regulations, legal framework, we should look now into the praxis. How were the girls and women committed to such wards were treated, were these wards actually closed or just semi-closed, what was the role of the physicians there in these wards, and how, if there was this politicized medicine which was shaped by the physicians, or whether some kind of other instances in Poland. So this is the work for future, the itinerary for future, to look into archives, to talk with people, make interviews, and see how this looked in the praxis. Thank you very much.
So thank you very much, Marcin, and we are back in the studio. As you see today with the video recording, everything was good. And so first of all, of course, I would like to greet, I have seen, Professor Carlos Viesca, Carlos Andreas Viesca, Alfredo has joined us. Very nice. On the peak of the translation, we were like 31, 32. So that is the general comments, and at the end of the session, I will return. But let's look, we have already 3 questions in the chat, and I will invite you to repeat the question. Evi, the first question is for you. Can you unmute your microphone and repeat this question?
Hi, thank you very much. Marcin, thank you, dziękuję bardzo. Thank you very much for your interesting lecture. 2 questions. One, what were the kinds of antibiotics that were available at that time in Poland? And secondly, maybe if you know, the sources of venereal diseases were also in the jail system or school or universities, not only prostitutes? Thank you.
So first of all, thank you for having me with you. Thank you for presenting my topic. And to answer your question, about the antibiotics, we see from the secondary literature that in some clinics, antibiotics were served as early as 1946. And since 1948, all clinics in Poland had antibiotics for treatment of syphilis. Treatment of gonorrhea with antibiotics started mostly at the similar time. So we can say that in 1950s, at the beginning of the 1950s, the treatment of venereal diseases in Poland was conducted mostly, almost wholly with antibiotics, with different doses. These doses changed over the years, but since 1950s, penicillin was used for treatment of venereal diseases. As to your second question, I have no information about the jail system, schools of universities as sources of venereal diseases. So this information, we didn't find this information in the secondary literature. We found the information that very many young girls were infected. However, what was the source of the infection? Well, it still needs to be researched.
Thank you, Marcin. I see that Florian, Professor Steger, is still traveling probably from Ulm to Munich in safe environment. You know, the study was conducted by the Ulm University and actually supervised by Professor Steger. I don't know, is it convenient for you to tell something? At least we will hear that you're really in the first class of the train. Okay. Yeah, Florian, we can't hear you. Yeah, okay. So what about the question from Mr. Jimbo? Where?
Hello?
Yeah, please,
Yeah.
Zhao, repeat your question for Mark.
Yeah, just hello everyone. Thank you very much for the lecture, Professor. I just want to say the putting aside the political trial, just according to you, just showed us the discussion number 4, which is you show a map, the whole Europe distribution. The left side of Europe, which is the Western Europe, is kind of blue, and the Eastern Europe, including Poland, Hungary, Soviet Union, is kind of a red side in the map. I mean, so I want to say, is this might be associated with some people thought about how the like persecution, how this thing work, how the people think about the sex, because in the communism party they usually influence the press, influence everything, they somehow just go in deep your mind and change the way of you thinking about the moral. They will think about, when they talk about the sexual behavior, sexual practices, it will be like kind of a shy and also do something. They think it's not they think it might be a sin. But in Eastern, I think the situation might be different, so the people, they could just talk this thing more open, if I use the word. So they probably gonna better protection if you study this very well. So this is my question for you.
So, if you're referring to the historical period, so after the Second World War, this peak in venereal diseases was observable in the whole Europe. So not only in the Eastern Europe, but also in Western Europe, countries like France, Italy, and so on. So I wouldn't say that there was a difference between particular individual reactions to this, but rather there were visible differences in the policy targeting this group, targeting people with venereal diseases.
So you mean the main, I mean the main thing is due to the politics?
Yes.
Oh, thank you so much. The politics, I mean, could influence the how they make the law and how they control the people thought, or just only about the politics, if you're talking about like the politician trial. Well,
of course, policy, politics influences how the law is created, yes. So we see this in Poland. There was this policy against particular groups of the society, so prostitutes, alcoholics, yes, and these groups were considered not accepting the moral code of the socialist society. Yes, so these groups were some kind of outside this moral code, and we see in the legal regulations that precisely these groups were targeted by the law, using using anti-venereal policy, using medicine, anti-venereal facilities.
Thank you.
Thank you. As you see today in the second lecture, actually, we are compare the Eastern Europe to Eastern Europe. It will be also interesting to compare the Eastern Europe in dictatorship maybe with another country outside, let's say, the Europe. And thank you, Evgenia, that you posted in chat your question. And it's simple, but at the same time, fundamental question. What did Polish physicians think about their duties to treat against patient will? Thank you, Evgenia. I repeated your question to Marcin.
Yes, actually, to say frankly, we don't know what the Polish physicians thought about. What did they think about this? Yes, so this would require more research, including interviews, interviews with the patients, interviews with the physicians, and so on. If we take the example of the German Democratic Republic, yes, there were several examples of physicians that seen this as their duty to to provide this kind of re-education of individuals that were seen as morally destructive, so like drifters, alcoholics, prostitutes, and they use their position, they use their power to conduct this kind of education in the spirit of politicized medicine. Right now, for Poland, we don't know this still, but I hope that in the next time in the future, we will be able to conduct the research and know a little bit more about the physicians' positions on this topic.
Yeah, it might be a difficult question. Of course, interviews is good tool, and Florian in his first lecture showed that it was really a result, but to find the right person who is ready to provide this information, who was, let's say, involved, of course, there are a lot of barriers. So any other questions? I know there's a study actually in partnership with the Ulm University. We started also to check how it was in Latvia. It's the biggest issue to achieve the archives because its access is limited. Not a lot remains probably. So the interview or the old documents, old publication might be the source. And I'm happy that INETA is doing it already in Latvia, and similarly is doing ISTIS in Lithuania and Maya in Estonia. Okay. Any other comments, questions?
Yes, please, to Marcin.
Yes, Alfredo.
Thank you. What about soldiers affected by venereal diseases at the end of the Second World War? I mean, were there special secluded hospitals to care them in Poland?
So there were special hospitals, special facilities for the soldiers in Poland. We do not know the number of the soldiers that were infected with venereal diseases. We do not know what kind of treatment did they receive there, because, well, with this kind of facilities, it's another issue of the some kind of protective measures, security measures, so the data wasn't provided to the public, or there was no statistics on the soldiers. But it certainly would be a very interesting topic to look into what kind of treatment the soldiers did get.
Thank you, Alfredo, for your suggestion. And it might be a good platform. Yes, of course, Professor Viesca, Carlos. Yeah.
Thank you very much. First of all, congratulations for all the 4 conference, and congratulations to Marcin for your very, very kind conference. I have one consideration. Poland was a country that suffered a lot in the Second World War, first by German invasion, after by the fight between Soviet and German, and maybe there were very, very important social determinants of health contributing to the invasion after 1945 of venereal diseases in Poland. Maybe this will be a very interesting field to explore. But my question now is, Marcin, you have some data about neurosyphilis in these periods?
well, there is some data to be found about neurosyphilis. However, I cannot tell you anything very precise right now. So I would have to look it up. What the number for this particular part of for this particular topic were in Poland.
Thank you very much.
Yes.
Thank you, Carlos, and thank you, Martin. I know that Professor Steger now is impatient but limited. Well, we are valued to see you in the train, but you can't speak to us, okay? But of course, you have a lot of comments because, as I told, he is conducting the study, and of course, he is interested to join in his project more and more, and not only from the Eastern Europe, but also in the other places. So, my friend Joel Donchin plays the question. Can you see? I wonder what was the procedure once you discover it as sick patient. How is in charge? Yeah.
Who is in charge? Or I mean, it's the law. But okay, I caught a prostitute in the street. So what now? Who is in charge? A physician, a politician, the Communist Party at those time, and then what? You enforce them with 2 policemen, bring them in, or is there any legal form that the patient has to read or to sign? Or I mean, if you look at this from our point of view, this is I mean, unheard of, especially right after World War II with the Nuremberg files and all this. So I wonder, it was the same question in the first lecture.
So legally, if we speak strictly legally, a prostitute needed to be should be referred to a doctor on the outpatient basis. Then some kind of test, she should be tested, and then if the venereal disease was if there was an incidence of venereal disease, then this individual should be treated in a hospital or by the doctor, and this was the doctor's decision. Yes, this is the legal point of view. So how it was written down in the legal act. In the praxis, it looked quite a lot differently. So in many cases, not all the cases, but in many cases, we see that women that were somehow suspected to be prostitutes or young girls were halted at the street, stopped at the streets or at some public places by the police force, and without referral to a doctor for the testing, they were directly brought to a venerology ward. Yes, and this is the situation that was very very much seen, very often seen in the German Democratic Republic. And from the secondary literature in Poland, we see the hints that this situation was also repeated in Poland. Yes, so there was this breach of legal regulations when the police directly, without referring to a doctor first for a test, brought a suspected person to the hospital.
So basically, the people were reluctant to go to a hospital if it's compared. Instead of treating the disease, you throw away the patient. And I'm not a prostitute. Like let's say, not from the point of view of the prostitute, from the customer. Let's say, okay, why should he go to get treatment? He will do it underground. He will not go to a hospital. If I know that it's compulsory and I'll be a criminal, that's against public health, most probably.
Well, you wouldn't be a criminal. It wasn't a criminal offense. Yes, it was treated like this. Yes, but legally it wasn't a criminal offense. But well, some people didn't know they were carrying venereal diseases. Yeah, especially if we talk about young people, they didn't have this knowledge how the disease occurs, what are the symptoms of the disease, and also, well, other kind of people didn't want to, if there was a danger that they would be committed to a hospital for several days or weeks, they didn't want to do this, of course. Yes.
Thank you.
Thank you, Marcin. Yeah, colleagues, it's somehow when I'm listening to the discussion and lectures, I see some parallels with our current situation. I mean, pandemic with a strong regulation, health regulation, and other things. What is nice, we also have like parallel discussion, at least between Florian and Ekaterina in chat. What is good, but I would like to be a good moderator of the meeting, and we agreed that we will work in 1 hour format for previous lecture and for this. So at this point, probably I will stop active discussion. Then you can contact Marcin anytime, and I would like to let's say that thank you for all of you participants of our, let's say, pilot project with 2 lectures, especially for Florian and Marcin, who was our lecturer. Now our website, Congress website, is open for you. I am inviting you with your lectures. It will be not pre-recorded, it will be online. Now we have not even like programs, computer programs, but even some skills how to manage, and we are open. So I suggest just contact Congress Secretariat or me, and we expect that for now we might have such meetings every first Thursday at the same time, so 6 p.m. Riga time, and I don't know how is in Carlos, probably 10
o'clock, 10 in the morning.
Yeah, and so even we can extend our project because we agreed that we will run the summer course for the young scientists, for students who are interested in the history of medicine, and such course was expected in Riga. Why not to start this course with your support and for different topic also on the Zoom platform, and then meet together during the Congress. So the time format, as I talk, might be like 30 minutes lecture, 30 minutes discussion. That is my proposal. So of course, I will publish in our society newsletter that, but I expect also that you will be supportive. We just, during the 2 lectures, we covered 1 topic, quite specific topic, quite let's say narrow topic, but the floor is open, and I think we can growing and we can stay together, what now is very important.
Yes, it's a very good idea.
Thank you.
I am sure we will have a very good support.
Thank you, Carlos. I will keep your promise. Probably you will be first speaker. Yeah, we will.
Of course.
We will communicate. But it's nice that President is supporting for our, let's say, online project of our society, online project, and it's a great feeling to see you and to thank you, because it will be strange if it will be only Marcin, me, and Florian. Let's say, yeah, we are a lot. We are the world.
Thank you very much.
Thank you very much. We are really just in 1 hour format. So as I told, Florian lecture already published just now on the web page, and probably in 1 week we also publish the Marcin lecture with the discussion. Thank you very much for all. Our 2nd lecture is over. Thank you, Avi. Thank you, everyone. And I'm waiting from you the suggestions. Goodbye.
Thank you. Goodbye.
Bye-bye. Bye-bye.
Bye.
Oh, very, very
Goodbye.
interesting. Thank you.
See you.